I'm Samuel Inoue. I'm 86 years old, and I'm a retired federal worker, retired after 60 years of government service. I have had problems with my heart, and it got to a point where I now have 7 stents in my heart, and I was still having problems with chest pains and shortness of breath. And so I ended up at Straub on an emergency basis, and that's when we decided that I probably should consider the new TAVR procedure. I became the first patient to undergo the TAVR procedure in the new hybrid cath lab that was established at Straub.
TAVR is a way that we can replace someone's aortic valve without open heart surgery. Make a 1/4-inch incision in the groin, right at the crease of the thigh, and that allows us to use the body's own plumbing to follow it back to the heart, and we can put in a new heart valve that way. This technology allows us to treat people who would not have even been considered for treatment in the past because their risk for a traditional open heart surgery was too high. On average, people are in the hospital 1 or 2 nights afterwards. In a case like Mr. Inoue's, where everything went very smoothly, he was out of the procedure room before noon and up in a chair before dinner time.
My wife really recognized the big change in me after I had that procedure. She says my color changed, and she didn't see me popping the nitro pills or getting out of breath. So she was the one that was probably the happiest by me having the procedure done. The cardiologist, he says I'm the bionic man.
I think this absolutely builds on the tradition of excellent heart care that has been provided here. It just allows us to continue moving forward at the cutting edge, the leading edge of technology.
I have to express my gratitude to the Straub donors who so generously contributed to the establishment of the new hybrid cath lab, since that's what made it possible for me to have the procedure done. Maybe 10, 20 years ago, they didn't have this kind of technology, right? And so I probably wouldn't be alive today.